I want to welcome everyone to the 2018 Live Well Data Summit. My name is Mel Milstein, and I'm a Group Program Manager with the Land Use and Environment Group with the County of San Diego. Very excited to be acting as your MC, and I emphasize the word acting because I am definitely not a professional. So I'll give you a few breaks here along the way, but I'm very excited to be here with you all to discuss data. Before I start, I just want a housekeeping note. Over to the left and another left are the restrooms for this building in case you're not familiar with that. And with that said, I just want to go through how the day is going to look as we move forward. So just to get an idea of the crowd in the room, if I can just get a quick show of hands, how many planners do we have in the room today? Okay. Government decision makers, park and rec folks, that kind of thing? Okay. How about healthcare provider, healthcare systems provider, that sort? Okay, we have a few back there. Okay. Social service professionals? Okay. And other nonprofits in the community? Great. Wonderful. It's a diverse crowd. Okay. So it's going to take a few minutes what to expect today. We have the day broken down into two parts. First part, we'll have a couple speakers for you, community leaders such as Supervisor Gaspar, public health experts such as Dr. Wood and Leslie Ray, and then Nicole from 211 San Diego sharing what they're doing with their data dashboard. And that'll be the first day. We'll take a short break after that. And following that, we'll get back into the built environment and walkability portion of the day. And this will be an open discussion with the audience, so with Q&A going back and forth. And basically the main goals for that portion are to share with you how the new built environment indicator data sets are available at city levels as well as other geographic levels, to offer methodology for creating built environment data sets and for measuring walkability, and to engage in discussion around, among other topics, the definition of community spaces and walkability as well as methodologies presented. Ultimately, we want to create a shared data set to benefit you all. And with all that said, I'd like to introduce our first speaker. So our first speaker is the chairwoman of the County Board of Supervisors. She was elected in 2016, the youngest woman ever elected to the Board of Supervisors. She was previous to that the mayor and city council member of the city of Encinitas, which she currently resides in with her husband Paul and her 3 young children. She's done a lot of work since taking over the Board of Supervisors, partnering with Supervisor Diane Jacobs on the Alzheimer Initiative, and also, want to make sure I get this right, recently introducing an innovative model that addresses prison recidivism, addiction, and homelessness through workforce training and personal accountability. So it's my honor to welcome Supervisor Kristen Gaspar to Welcome Remarks.
Good morning, and what your MC failed to tell you, he was a famous Hollywood actor. Ask him at the break. So acting director is a title he's well familiar with. He also left out my favorite, my dachshund, Frankie. So I'll share with you, that's another important member of my family. Well, thank you, good morning. Thank you for coming to the 3rd annual Live Well San Diego Data Summit. And you're excited. If you call awkwardly, it forces a clap from the audience. I've learned this. But I'm excited for this year's summit theme, connecting with community spaces. And I'm happy that you've connected with each other and kind of squeezed in here in the facility. When neighborhoods are walkable and community members have close access to community spaces, those communities are better connected, they are safer, and they are indeed more vibrant. Walkable and connected communities have lower crime rates, lower rates of childhood obesity. Community members, they take ownership of their neighborhoods, which in turn make the neighborhoods safer and more walkable. Studies show that when children are active and healthy, their academic performance greatly improves, which in turn reduces crime, which makes our communities safer and walkable. You can probably see this cycle of positivity here. This also contributes to the economic health of our region. The more walkable a community is, the higher the home values are in those communities. Not only that, but those same homes tend to retain higher values during an economic recession, which reduces the rates of foreclosures and bankruptcies. So from an economic perspective, it's a benefit to the entire region to have communities with excellent walkability and plenty of community spaces. And let's face it, walkable and connected communities are just more fun to live in. Meaningful connections happen when neighbors have shared interest in their community, and purposefully create a more safe place to live, work, visit, and raise your family in Doxon. So, how do we measure and assess community connectedness in a way that makes sense all across San Diego County? Municipalities, nonprofits, and community-based organizations that are represented here in the room today, you are all doing wonderful work in our communities, but often disconnected or unaware of other groups who may be trying to accomplish similar things. That's why we've brought you together into this room where we've locked the doors for the next 4 hours. Because today we're hoping to facilitate connections between each of you and help bridge these gaps to bring to fruition the outcomes that many of you are striving to achieve. Innovation was the theme of the State of the County address earlier this year, and bringing this type of innovation to life requires a sustained network of vibrant and innovative people. You, even our planners, you're vibrant people too. You're working together for a common goal of making our communities safer, healthier, economically resilient, and better connected. The presenters at today's summit are going to share with you an innovative and transformative model and methodology for measuring the walkability and connectedness of our region to achieve a collective impact. We all know that's Nick Machione's favorite words, the collective impact across our entire region. This is a process and tool that you and your staff can implement right away. You determine the data that goes into this process. It's not me telling you what to do. But imagine each municipality having full ownership of their data while contributing to the greater mosaic of community spaces and walkability scores across all of San Diego County. Ultimately, it's our hope that we work together to make the Live Well vision happen, a reality for everyone who calls San Diego County home. That means not only measuring the walkability and connectedness, why can I not say that word today? Connectedness. And you know it's the opening day of the pumpkin spice latte, so there's no excuse for that. As an end to itself, but a means to ensuring that our existing neighborhoods and communities become transformed for the better, and that our future communities are created and designed for healthy, safe, and connected living. Thank you very much for being here today and for being a part of this vision and innovative process. I hope you all have a wonderful day. The door will unlock in exactly 4 hours, and that you walk away more connected. Thank you. Have a wonderful day.
Supervisor Gaspar, thank you so much for taking the time out of your busy schedule. Not only thank you for being here, but thank you for calling me a professional actor. Now I might get that casting call I've been waiting for 20 years. Thank you. Fingers crossed. Thank you, Supervisor. So our next guest, my pleasure also to introduce our next guest, and that is our Public Health Officer for the County of San Diego. For 11 years, Dr. Wooten has been a public health officer for the county. Prior to this, she was a deputy health officer from 2001 to 2007. She is a UCSD volunteer associate clinical professor and an adjunct professor at SDSU and UCSD's Graduate School of Public Health. She is an ardent supporter of public health and has a strong interest in health disparities and health equity. Dr. Wooten will talk about she will talk on how built environments and walkability align with the Live Well vision. Dr. Wooten, thank you for being here. Welcome.
Good morning, everyone. How are you? We are happy to have all of you here today for what we feel is going to be a great next 3 hours. So, if I had to ask every one of you what was the greatest impact and had the biggest difference as a risk for premature death, which one of these would you guys say if you didn't have this? I'm guessing many of you would say access to health care. But in fact, that's not true, as is evidenced by the slide here. Genetics we can't do anything about, that's a large piece of the pie. But the two components that have the greatest impact or make the biggest difference on our risk for premature death is social and environmental factors at 20% and individual behavior at 40%. Now, individual behavior is the foundation of one of the first components of Live Well San Diego. And that's the 3-4-50 concept, which is a World Health Organization concept that basically states that there are 3 behaviors: physical inactivity, poor nutrition, and tobacco. And we add substance abuse and alcohol in there with that contribute to 4 chronic conditions: cancer, heart disease, and stroke, diabetes, and lung conditions, specifically asthma and COPD. It does not include lung cancer. That these conditions contribute to over 50% of death in San Diego, but worldwide over 50%. And in San Diego, these conditions account for 54% of all deaths. We have 20,000 deaths in San Diego each year. So this is a major contributing factor to the deaths that we see each year. So the 3 components of Live Well San Diego, again, 3-4-50 is a foundation for the Building Better Health component, which was conceived and approved by our Board of Supervisors in 2010. But as a result of going through our visioning and coming up with the 3-4-50 concept, we realized that health is not the only thing that matters when we talk about health and wellness. We have to ensure that our community is safe and that also our residents have a significant quality of life. Hence the other 2 components, living safely and thriving. Just to briefly break down each of the 3 components, Building Better Health consists of 4 objectives: access to quality care, increased physical activity, or we refer to as active living, healthy eating, and tobacco use. So we want to stop tobacco use, we want to increase healthy eating and healthy living, and we want to increase access to quality care. The second component, living safely, really looks at 3 major outcomes, and the overall goal is to ensure that our residents are safe in our region. These outcomes relate to residents being protected from crime and safety, from crime and abuse, but it's not only about crime. It's also about neighborhoods being safe where they live, work, learn, and play, as well as residents or in communities being resilient after we have disasters or health emergencies. The last component is thriving, and the thriving component was developed a little bit different than the first 2 components. For this last component, Luge was the lead here, and they convened over 70 stakeholders, and I would imagine some of you here in the audience were involved in that process. But there were 3 focus areas that resulted, and these are built in natural environments involving transportation, the built environment in neighborhoods, and that would include examples like safe streets or complete streets and safe routes to school, the natural environment and housing, which is a big issue in San Diego, as you all know. And then the second focus area was enrichment, which is civic life and community activities. Basically, if people volunteer or are involved at their community level, they are connected. And then the last focus area is prosperity, economy, and education, which involves workforce development and economic development. A foundational component of Live Well San Diego is the collective impact. And the collective impact has 5 components, as you see here. But the major thing here is that there is a common agenda. And many of you are Live Well partners. And everybody does what they do in their lane to achieve a common goal. And that's what makes Live Well San Diego, we feel, very unique. There's also, there are shared measurements, and we'll get into the 5 areas of influence and 10 indicators in a bit, but that's how we measure the success of Live Well San Diego. The second or third component is mutually reinforcing activities. As I stated before, everyone is doing what they do to achieve a common goal. And continuous communication is always important. You can never communicate enough, I feel. We have regional community leadership teams, there are action teams, partner events, and we have an opportunity for all of our partners in the community to communicate through our website, which is livewellsandiego.org. Lastly, you have to have a backbone organization. Currently, the County of San Diego is the overall backbone, but depending upon the topic, some of our partners can be backbone organizations as well. So, Live Well San Diego, although we didn't start out with the concept of bringing on community or Live Well partners, it was an organic development with Oceanside being the first entity to request or ask us, can we be your partner? And that idea was born. So currently we have over almost 400 partners, 395 partners, recognized Live Well partners that again are doing what they do best in their lanes. And specific to today's event, the government partner plays a big part. And if I go back to the prior slide, there are 4 primary sectors that we engage in Live Well San Diego. There are cities and governments, business and media, as well as community and faith-based organizations, and then our schools and education at all levels. So you'll see on this slide, we have 15 of the 18 city municipalities that are Live Well partners, as well as our unincorporated area of San Diego. And this is going to be our focus. You are our focus today, the cities and government sector. When it comes to measuring results, in my last few slides, we have 5 areas of influence: health, knowledge, education, community, and social. And if you look to the far left, these are the top 10 indicators that we use to measure our progress. Now, today is all about data. Leslie is going to be talking about that, but just to let you know, there is a Live Well data portal that has access to information, much of which Leslie is going to share with you today. So as the focus of today's event, as our government partner, there have been many activities that we have worked on with you as government partners over the past several years. And some examples include the fact that there are cities like Chula Vista, Lemon Grove, and Ensenada. All of these have initiated safe routes to school projects and programs. National City has completed over 5 miles of new bicycle facilities and a community corridor for riding, safe riding. The Air Pollution Control District has coordinated with Circulate San Diego, SANDAG, and the City of San Diego to promote the installation of a multi-use urban trail network. And then lastly, the City of San Diego partnered with Deco Bike to launch a bike share program. These are just a few examples of the activities that many of your municipalities have worked on in collaboration with the city and other partners to improve the health and wellness throughout San Diego County. So as I close here, I just want to say that you are the focus today. The city governments make significant strides every day in improving the health of the residents of San Diego, and we hope that after today and coming up our Live Well Summit, we will open the door for more opportunities to come. So in summary, I'd like to say, and actually I didn't progress my slides either, but that's okay. In summary, I just want you to remember that your 90-minute elevator speech is that there's one vision for the region of San Diego, and that is to implement the 3 components: building better health, living safely, and thriving across 4 strategic approaches, which is building a better delivery service system, as well as ensuring that we have policies and procedures in place to make the healthy choices the easy choice, as well as changing the culture within. Those are our 4 approaches. And these are achieved by those, we are measuring success by the 5 areas of influence across the top 10 indicators, which you will hear more about in this morning's discussion. So thank you very much for your time, and we hope you enjoy your day here this morning.
again, Dr. Wooten, for being here. So our next speaker